Welcome to HeInfo. This video is about benzodiazepines for anxiety. What you need to know. Anxiety can manifest in various ways, from panic attacks to persistent feelings of fear and worry. Anti-anxiety medications are often used to help manage these symptoms, and among the most commonly prescribed are benzodiazepines. Benzodiazepines are a class of medications that alleviate anxiety and promote relaxation. They are also used for a variety of other medical purposes, including as muscle relaxants, sedatives for surgical procedures, and treatments for seizures and alcohol withdrawal. Often referred to as minor tranquilizers, sedatives, or hypnotics, benzodiazepines are among the most widely prescribed psychoactive drugs worldwide. The role of benzodiazepines in anxiety treatment. Benzodiazepines work by enhancing the activity of gamma-aminobutyric acid, GABA, a neurotransmitter in the brain that reduces activity in the nervous system. This results in a calming effect that can help relieve anxiety, reduce panic symptoms, and promote better sleep. While benzodiazepines are effective, non-drug approaches to anxiety relief, such as exercise, meditation, and therapy, should be considered first whenever possible. Activities like yoga, tai chi, or even a walk outdoors can naturally alleviate anxiety. Talking with a trusted friend or therapist can also help address underlying stressors. When these non-medication approaches are insufficient or unavailable, benzodiazepines can provide much-needed relief, especially for short-term or situational anxiety. How safe are benzodiazepines? When used as prescribed, benzodiazepines are generally safe and effective. However, they have the potential for misuse and dependence. For this reason, they are typically recommended for short-term or occasional use rather than as a long-term solution. Common side effects of benzodiazepines. At low doses, the side effects of benzodiazepines are usually mild and include drowsiness, sedation, dizziness, loss of balance. At higher doses, more pronounced side effects may occur such as confusion, disorientation, amnesia, breathing difficulties, depression. In rare cases, individuals may experience agitation, hallucinations, or nightmares. Lowering the dose often reduces these side effects. Benzodiazepines can temporarily impair learning, memory, and the ability to perform certain tasks. These effects wear off as the medication leaves your system. However, when used to aid sleep, they may cause hangover effects, such as grogginess or drowsiness the following day. Types of benzodiazepines for anxiety. Several benzodiazepines are commonly prescribed to treat anxiety disorders. These include clonazepam, Rivotril, alprazolam, Xanax, lorazepam, Ativan. Other benzodiazepines, such as bromazepam, lectopam, oxazepam, Cerex, and diazepam, Valium, may also be used. For insomnia, benzodiazepines like temazepam, Restoril, triazolam, Halcion, and flurazepam, Dalmane, are often prescribed. A related medication, zopiclone, Imovane, works similarly to benzodiazepines and may have a lower risk of abuse, though it is still possible to develop a dependence on this drug. Forms of benzodiazepines. Benzodiazepines are available in various forms, including tablets, capsules, sublingual tablets, which dissolve under the tongue, and injectable solutions. These options provide flexibility based on the patient's needs and the healthcare provider's recommendations. Important considerations. While benzodiazepines are effective for managing anxiety, they are not a one-size-fits-all solution. Patients with a history of substance abuse or those at risk of dependence should approach these medications with caution. Always discuss your medical history and concerns with your healthcare provider to determine whether benzodiazepines are the right choice for you. In conclusion, benzodiazepines for anxiety can offer significant relief when used appropriately. However, combining them with lifestyle changes, Therapy and other non-drug approaches can lead to a more comprehensive and sustainable strategy for managing anxiety. Frequently asked questions about benzodiazepines. How long should I take benzodiazepines? Benzodiazepines are typically used short-term. They are most effective, occasionally, for managing sleep issues or severe anxiety when non-drug methods fail. Daily for a few weeks, to stabilize sleep patterns or ease anxiety while waiting for other treatments, like antidepressants, to take effect. Some individuals may use benzodiazepines long-term under a doctor's supervision if the benefits outweigh the risks. If you've been on them for an extended period, consider having your prescription reviewed by a healthcare provider. Are benzodiazepines addictive? The risk of addiction is low with occasional or short-term use, but increases with prolonged or high-dose use. People with a history of substance abuse are at higher risk. Signs of addiction: cravings for the drug, difficulty stopping use despite negative effects, taking higher doses than prescribed, physical dependence. This occurs when the body adapts to the drug, leading to tolerance, diminished effects over time, and withdrawal symptoms if stopped suddenly. Withdrawal symptoms: mild anxiety, insomnia, headaches, and fatigue. Severe, in high-dose users, agitation, paranoia, seizures, or delirium. How can I use benzodiazepines safely? Follow your doctor's instructions closely. Never increase your dose on your own. Try to skip doses once you've achieved a few nights of good sleep. If you've been using benzodiazepines regularly for weeks, consult your doctor before stopping to avoid withdrawal symptoms. How can I safely cut down or stop taking benzodiazepines? For short-term users, stopping benzodiazepines is often straightforward. However, if you've been taking them long-term, gradually tapering your dose over time is crucial to minimize withdrawal effects. The ideal tapering schedule varies based on the specific medication, dosage, and duration of use, so consult your doctor for a tailored plan. High-dose users may require medical supervision to discontinue safely. Can benzodiazepines interact with other medications? Yes, benzodiazepines can interact with various medications, including over-the-counter drugs and herbal products. Always inform your healthcare provider about all medications you're taking. Combining benzodiazepines with sedatives like alcohol or opioids significantly increases the risk of overdose, which can be life-threatening. Can I drink alcohol or coffee while taking benzodiazepines? Avoid alcohol, as it amplifies the sedative effects of benzodiazepines, increasing the risk of overdose, falls, and other injuries. Excessive caffeine consumption may counteract the anxiety-relieving effects, reducing the medication's efficacy. What about using street drugs with benzodiazepines? Street drugs like marijuana or cocaine can worsen anxiety and disrupt sleep, undermining the benefits of benzodiazepines. Using them alongside benzodiazepines or to enhance other sedative drugs is dangerous and raises the risk of overdose and serious harm. Do benzodiazepines affect driving? Yes, benzodiazepines can impair your ability to drive safely, especially when combined with alcohol or other sedatives. Avoid driving or operating machinery if you feel drowsy or slowed down. The risk is highest when you first start taking the medication. Will benzodiazepines impact my sex drive? There's no conclusive evidence linking benzodiazepines to changes in sex drive or function. Is it safe to take benzodiazepines while pregnant or breastfeeding? Pregnancy. The risk of birth defects is thought to be very small. However, regular use near delivery may cause drowsiness or withdrawal symptoms in newborns. Breastfeeding. Benzodiazepines can pass into breast milk, potentially causing drowsiness in babies. Always discuss risks and benefits with your doctor if you're pregnant, breastfeeding, or planning a pregnancy. Can children or teens use benzodiazepines? Benzodiazepines are generally not recommended for children or teens, except for sedation before surgery or brief procedures. These medications may cause irritability rather than calmness in young users. Are benzodiazepines safe for older adults? Older adults are more sensitive to benzodiazepines, which can increase the risk of confusion, falls, and fractures. Long-term users may need an extended and cautious tapering process, but some cases may require continued use with regular monitoring of side effects. Thank you for watching HeInfo, where we bring you the knowledge to help your loved ones thrive. Don't forget to like, share, and subscribe to join us in spreading awareness. See you in the next video.